Good evening. Here is my final project about measles. So just so we get started, measles, along with many other diseases, have impacted the world in many ways. Measles was introduced by John of Gaddison during the 1280 through 1360 BC as the equivalent of the Latin term morbelli. During the Middle Ages, which took a widespread in multiple countries, the measles outbreak, along with multiple diseases, were very hard to contain until the leprosy outbreak that threw its shadow over the daily life of the medieval humanity, causing the aspect of public health to develop. While religion had the greatest effect of public health as church became very powerful, they proceeded to dominate most facets of civil society, including the art of medicine. Philosophers such as Hippocrates was an early physician who used his writing to stress the meteorological variations in the character of seasons as the elements determine rise and fall of epidemic diseases and variations in their seasonal and annual incidence. Medicine belonged to the priestly class and was largely magical religious with three types of healers, divines, exorcists, and physicians. In order to keep records of all the diseases and cures, many hundreds of clay tablets recorded descriptions of ailments such as abscesses, apoxes, appetite control, colic, constipation, cough, eye, ear, fevers, gallbladders, trouble, heart disease, intoxication, nose, skin diseases, tumors, venereal diseases, measles, of those sorts. Physicians were educated in priestly administered schools associated with the temples, and the students learned from the recorded clay tablets and practical experience. While there were many historical documents that addressed the measles outbreaks, Avicenna believed that the aim of health was to guide the human body towards attaining an advanced age or natural span of life. In other words, a healthy man should die from old age rather than as a result of disease. The teachings of such as the canon of medicine is considered the medical masterpieces, as each book relates to one medical issue. As the advancement of medicine began to happen, ultimately the Romans, who measles affected mostly, were able to advance the treatment and disappearance of the disease. After being able to show the incubation period, Peter Ludwig Punan found all ages susceptible to the disease, and he also noted that one attached conferred immunity. Furthermore, Punan showed that the disease is most communicable during the eruption and flourishing of the rash, that it may also be transmissible during the prodromal period, but found no evidence of transmission in the disquasiment stage. In 1968, a monovalent measles vaccine was introduced for infants in England and Wales, and it followed in 1970 by a rubella vaccine for schoolgirls and susceptible women. Monovalent rubella vaccine available to susceptible adult women for the first 3 years of the program. A catch-up dose was also offered to children at ages 4 and 8. When we discuss how this disease has progressed and the nature of preventative care for the diseases, that's what we were referring to. The number of confirmed measles cases has remained low since the measles rubella campaign, and most cases arise in unvaccinated preschool-aged children and young adults. As a result, it is safe to say that these major steps have ultimately been the best advancement since the Middle Ages, as the cure for measles still hasn't stopped the spread of the disease. to make people the top priority by making sure. So basically, in order to advocate for patients and to find ways for all nations to join first forces and contribute ways to ensure all people have received their injection unless otherwise allergic, while finding more than one way to prevent the disease, is to make people the top priority by making sure all people have accessible, affordable, and the best health preventative care in order to secure the world. I would like in closing to quote Henry E. Segrist, wrote in 1943, his concern was health, but his views are equally relevant to the global environment. Since the world has become very small as a result of present means of communication, we must think and plan not merely on a national but on an international scale. There is human solidarity in health matters, which cannot be discarded with impunity. That is my final project on the measles. Thank you.